symptoms of someone with high serotonin may include agitation. Some people experience an increase in inner restlessness or feel agitated when serotonin levels become too high. This may seem counterintuitive, as low levels can also lead to agitation, but abnormally high levels can produce the same effect as well. Dilated pupils, dizziness, fatigue, goosebumps, headache are some other common symptoms. High levels of serotonin can also increase the blood pressure, and in some cases may cause a permanent condition known as pulmonary hypertension. Serotonin has been directly linked to the cause of certain types of hypertension. It is recommended to keep serotonin levels within a safe range. Some people may experience hypomania as a result of a serotonin increase beyond normal means. This may occur in individuals with bipolar II disorder, but others may experience it as well. This is characterized by significant talkativeness, socialization, euphoria, and risky behaviors, known as mania, which is an example also of excess speeding. In some people, mania may be triggered by high serotonin levels, while mania may be more likely to occur among those with bipolar disorder. Artificially elevated serotonin as a result of pharmaceuticals may also cause temporary mania. A rapid heart rate is also another symptom. Relaxation. For certain individuals, the relaxation response is enhanced by mild to moderate elevations in serotonin. This is what tends to reduce various types of anxiety and phobias. The serotonin elevation helps the person stay calm and remain relaxed in situations that would otherwise stress them out. Restlessness, shivering, sweating, and weight gain are also other symptoms associated with serotonin high levels. More fatal symptoms include confusion. A serious symptom that may emerge is that of mental confusion. The person may struggle with memories, conversations, and may appear to be acting drugged. In some cases, high levels of serotonin are fatal and could end a person's life. Some people develop severe diarrhea from serotonin toxicity. This is a neurotransmitter that is found in the gastrointestinal tract and may be involved in digestive processes. Too much serotonin disrupts the gastrointestinal tract and can result in diarrhea. It is common to experience changes in blood and body temperature as a result of serotonin syndrome. Individuals might experience body shivers as well. It was already mentioned that you may experience an increased heart rate, but you may also experience an irregular heartbeat, which is problematic. An irregular heartbeat may put excess strain on heart functioning. Losing balance quite easily is also a symptom. Muscles may twitch excessively as a result of serotonin elevations. In extreme cases, some people respond to serotonin increases by having seizures. Some people may end up fainting or becoming unconscious if serotonin levels are too high. Some people end up feeling nauseous with flu-like symptoms that they end up vomiting. Lastly, feeling physically weakened is another symptom. Some ways of reducing serotonin includes activated charcoal, an obvious intervention for preventing high serotonin after ingesting too many antidepressant drugs or a combination of antidepressants. Certain dietary strategies can help reduce the amount of serotonin, including substances like gelatin and collagen are thought to help decrease the production and absorption of serotonin. A lower carbohydrate, higher protein diet should help reduce serotonin levels. There are several drugs that doctors will administer patients with abnormally high levels of serotonin. Most commonly administered are 5-HT2A antagonists, which help reverse the effects of serotonin toxicity. A couple of common used 5-HT2A antagonists that doctors prescribe for individuals with abnormally high serotonin includes cyroheptadine and chlorpromazine. Supplementing branched-chain amino acids can decrease serotonin levels. Individuals should consider supplementing L-tyrosine or a dopamine substance, as it may counteract the effects of serotonin. There are several conditions and situations in which a person may end up with abnormally high serotonin. The most common cause of high serotonin is from taking antidepressants. Mixing multiple antidepressants or exceeding the recommended dosage guidelines of the current medication may result in serotonin syndrome. Some people that use illicit drugs aren't aware of the fact that they could end up experiencing serotonin syndrome. This is a risk with certain stimulants, such as psychedelics and various opioids. While most people do not end up experiencing serotonin syndrome from a low dosage of illicit drugs, higher dosages and or interaction effects can produce high serotonin. After prolonged use of serotonin-based antidepressants, people can develop osteoporosis. This is due to the fact that when serotonin levels increase in the intestinal tract, it leads to bone loss. Overmethylation is a condition caused by polymorphism of a gene. Those that are overmethylators tend to create abnormally high levels of neurotransmitters such as serotonin. There is significant evidence to support the idea that high levels of serotonin can cause pulmonary hypertension. Serotonin elevations lead to constriction of the blood vessels and thickening of the heart valves. Long-term elevations of serotonin is a likely contributor to this condition. The most common condition associated with high serotonin is that of serotonin syndrome. This is a potentially fatal condition stemming from too much serotonin within the central nervous system. Serotonin syndrome can affect a person's cognitive function, coordination, and balance, and result in flu-like symptoms. Normal serotonin levels help regulate sleep, reduce pain, make us feel calm, and improve our mood. Abnormally high serotonin, as mentioned previously, can cause symptoms like anxiety, carbohydrate cravings, depression. Serotonin may not be as important as dopamine for cognitive function, but it still helps. Serotonin has been found to enhance cognitive function and, in some cases, correct various aspects of cognitive dysfunction. Perhaps the biggest drawback associated with the low levels of serotonin is that of poor consolidation. Studies have shown that serotonin signaling in the gut plays an important role in the development of irritable bowel syndrome. Increasing levels of serotonin often help correct this condition and improve digestion. Those with many other symptoms on this list and digestive problems may find that low serotonin is partially to blame. Normal levels of serotonin tend to help promote healthy digestive function. Those with low levels of serotonin may also be more emotionally sensitive, have fatigue, headaches, libido changes, light sensitivity, low self-esteem, mood swings, obsessive thoughts, overreactions, pain sensitivity, restlessness, sleep problems, social withdrawal, sound sensitivity, suicidal thoughts, and weight gain. Low serotonin is also associated with insomnia due to the fact that serotonin levels help with melatonin production. If a person has an abnormally low level of serotonin, their arousal may not decrease at the proper time of night in accordance to their circadian rhythm. This is likely to result of inadequate melatonin stemming from low serotonin. Another sign that serotonin levels may be low is irritability. Minor annoyances may trigger full-fledged anger, and you may find yourself snapping at others. Intense anger is often improved when serotonin levels are increased within a normal range. Some ways of increasing serotonin levels are dietary changes. Making some simple dietary changes can elevate the serotonin level. Consider the planning of consumption of foods that are rich in tryptophan, an amino acid that your body converts to serotonin. Carbohydrates will help make tryptophan more available and can be an effective short-term strategy to raise serotonin. There is some evidence that consistent exercise may be effective at elevating levels of serotonin and improving its synthesis. It is believed to do this by increasing the availability to tryptophan as a result of fatigue. The easiest way to increase serotonin levels is by taking a pharmaceutical-grade serotonin medication. Most commonly prescribed drugs that target the serotonin system are selective serotonin reuptake inhibitors. These are effective for increasing the levels of extracellular serotonin in a short period of time. Individuals may want to consider increasing the amount of sunlight exposure they get during the day. Low levels of vitamin D are associated with slower production of serotonin in the brain. There are several supplements individuals could take if they suspect that the serotonin levels are lower than average. Supplementing with either L-tryptophan or 5-HTP could be beneficial. L-tryptophan is likely safer than 5-HTP, but neither should be consumed over the long period of time because the effects could be dangerous. Some conditions associated with low serotonin levels are autism, anxiety disorders, eating disorders, major depression, migraines, and sleeping disorders. Fibromyalgia is a condition characterized by body aches, muscle pain, and tenderness. Individuals diagnosed with this condition tend to have highly sensitive pain and have a low threshold for pressure. It is thought that dysregulation of serotonin metabolism may be a contributor to this condition. Some people experience relief from certain symptoms by elevating their level of serotonin. Serotonin plays a key role in this process of digestion and gut functions. Those with irritable bowel syndrome tend to not have enough serotonin for proper digestion. This leads to a person experiencing excessive diarrhea, abdominal pain, or flatulence. It is a very common condition affecting millions of people. Many people find relief from increasing their serotonin levels with an antidepressant medication. Obsessive-compulsive disorder has been associated with lower than average levels of serotonin. Undermethylation. Those with undermethylation have mutations in a gene which leads to high levels of methyl. Individuals who are undermethylators end up depressed, partially as a result of lower serotonin levels. Fixing the methylation problem with dietary interventions and supplement routine can lead to a normalized serotonin levels. Thank you for watching my presentation, and here are my sources.